Look okay? All right, great. So welcome everybody to today's educational event. Again, my name is Mallory Mark. I'm one of the physical therapists here at Turning Point. I will be doing the part of today's presentation, and then Jill Binkley is going to finish up and do the second half of it. So I'm going to pass it off to her after my portion. Thank you again, Aurelis, for helping to facilitate today's event. And like she said, really happy to answer any and all questions that we can. Please feel free to post them in the chat box. And then anything that we don't get to, we will do our best to answer later via email. So with that being said, let's go ahead and get started. All right, so some objectives for today's educational event. Really, we would like for everyone to just have a basic understanding of the role of the lymphatic system, what it does in your body, what it's designed to do, and then understanding lymphedema onset, prevalence, incidence, and then really understanding risk factors, being aware of potential triggers, how to avoid potential triggers when possible, early detection of lymphedema, understanding some early signs and symptoms, and then moving on into lymphedema management, which is kind of where I'm going to hand it off to Jill, talking lots about exercise. Of course, as physical therapists, you know, we believe heavily in that. And then kind of debunking some of the myths that come with exercise and things like that. So bear with me while we just go a brief overview of the anatomy of the lymphatic system, and then we'll move on from there. Okay, so as you can see here in this picture, perfect. Just a brief overview of the lymphatic system and how it's laid out in our body. You can see the collections of lymph nodes in various parts of your body, ultimately connected by those lymph vessels and then other major components of your lymphatic system. We've got your spleen, thymus gland, tonsils, and lymphocytes. All right, so what does the lymphatic system do? So your lymphatic system is designed as a one-way system, and then it's running really, really closely with those arteries and veins in your body. And ultimately, it's designed to clean up unwanted material, waste, bacteria. So it's filtering out all that stuff that your body doesn't need and then returning that fluid back to your circulatory system. So because it plays such a big role in helping to take out the bacteria and viral things like that, it plays a big role in our immune function. I really like this picture over here, the one to the right. It kind of just shows the connection of the lymphatic system to both your arteries and veins. So you can kind of see the lymphatic system there in the middle acting as almost the middleman. So this is showing at the level of the capillary bed, so kind of the smallest level in terms of exchange of fluid between arteries and veins. You can see the blood flow is going to come into those lymph nodes, lymph vessels, get all cleaned up, and then it's going to be returned to your circulatory system, which is ultimately dumping up here into your heart, so into your subclavian veins. Again, so that's just a brief overview of what the lymphatic system does in the body. All right, so this picture is kind of breaking it down even further. So this is looking at a single lymph node. So you can see up there at the top right corner, unfiltered lymphatic fluid is going to be entering in that lymph node, and then it's going to be getting cleaned up, and then it'll exit that lymph node and ultimately, again, rejoin back into your circulatory system as filtered and cleaned up lymph fluid. So it's filtering out that bacteria, that debris, that unwanted excess material. And then bear with me, last little bit on lymphatic anatomy, just a quick video kind of showing, again, the connection here. And he's got a pretty cool accent, so much more interesting than me talking. So just about a minute, so bear with me while we listen to this real quick.
I can't hear him.
Oh,
There's no sound.
1 second. Sorry, guys. I'm not sure. The volume is turned on. You can't hear anything, Aurelis? Nothing?
No, it sounds very, very faint.
Helps our bodies get rid of toxins, waste, and other unwanted materials, including infections and cancer cells. It is a system of thin tubes called lymph vessels and lymph nodes, or glands. These run throughout the body. The spleen, thymus, tonsils, and adenoids are also part of the lymphatic system. Along the lymph vessels are small bean-shaped lymph glands. You might be able to feel these in your neck, under your arm, and in your groin, but they are also throughout the body, including the chest, abdomen, and pelvis. The lymphatic system carries a colourless liquid called lymph. As the blood circulates around the body, fluid passes from the blood into the body tissues, carrying food to the cells. This fluid bathes the tissues to form tissue fluid, which collects waste products, bacteria, damaged cells, and cancer cells if there are any. The fluid then drains back into the lymph vessels, where it is transported towards the lymph glands. The glands then filter the lymph, taking out any harmful products. The lymph also contains lots of white blood cells called lymphocytes, which help us fight infections. The lymph eventually reaches a large vessel at the base of the neck, called the thoracic duct, which passes the filtered lymph back into the blood circulation. If the lymph vessels or nodes are blocked, removed, or damaged, it can cause a buildup of fluid. This can cause swelling, known as lymphedema. For more information about lymphedema and cancers,
All right, okay. Thank you, everybody, and thank you, Janice, for the technology help. Okay, so what is lymphedema? So the textbook definition of lymphedema, it's categorized as a chronic progressive disorder as a result of the impairment of lymph flow. So an impairment of flow from the blood circulation due to damage of the lymphatic system. So because of that damage or blockage of the lymphatic system, that fluid is not able to as easily pass or filter through. So fluid then accumulates in between those spaces, in between your tissues, and that's where the swelling comes from. So you can see here listed are some various reasons for damaged or blocked lymphatic vessels. The ones that we're going to be primarily discussing are surgery, radiation, but you can see other ones there: injury, paralysis, infection, or inflammatory condition. And I just like this picture over here to the right because I think it does a nice job of showing that one-way flow of lymph fluid moving in towards the center of your body. And then you can see, for example, if you've got some damage or removal of lymph nodes in the underarm, how that can create some type of blockage or impairment of lymph flow. Okay, so lymphedema specifically in breast cancer. So lymphedema in breast cancer is caused by either removal of lymph nodes in order to stage the extent of the cancer and or radiation. So those are the two most common causes. The incidence of lymphedema, so how often does this occur? The research tells us that this happens in about 20% or about 1 in 5 women diagnosed with breast cancer. And really the differences with some of the numbers that we see come from differences in surgical techniques and differences with radiation. So it can vary from patient to patient. Onset of lymphedema, so when does this typically occur? We know from the research, you can see listed there below, it typically happens within 6 months to 3 years post-treatment. A majority of the women that are going to experience lymphedema, so about 80%, experience it by 12 months after surgery, so a year following. In some cases, it does occur following a triggering event, so something that brings all kinds of fluid to the area or an increased fluid load to the affected area. And then basically with that increased fluid demand and that compromised lymphatic system, it creates a bit of a backup because that lymphatic system is no longer able to keep up with the increased demand. So that backup results in the visible swelling that we see. All right, so risk factors. Let's talk all about risk factors. So what are the risk factors for lymphedema? The number one risk factor being the number of lymph nodes removed from your axilla or your underarm. Of course, your incidence of lymphedema is going to increase with the number of nodes you've had removed. Most of us anatomically, we have 40 to 50 lymph nodes in our underarm. And then, of course, minus however many they took in order to stage the cancer. And the second risk factor being radiation therapy. And really what happens with radiation is it decreases the filtering function of those lymph nodes. So some scar tissue is laid down, some tissue changes happen surrounding those lymph nodes. So it's harder for fluid to pass through and for those lymph nodes to be able to filter out that fluid. The third factor being increased BMI. So your body mass index is your height weight ratio. And the research tells us that the threshold number is 25. So as you get above that number, your risk is then increased. Of course, lifestyle factors also play a role in that. So Those that lead a bit more of a sedentary lifestyle, less active, is also going to contribute to that. And then the last one is arm infection and or injury. And really what happens with infection or injury, both of those lead to inflammation. That's how your body helps to heal itself. But again, like we talked about in the previous slide, that is increasing the fluid load and demand on that compromised lymphatic system. So again, because of the compromised lymphatic system, it's not able to keep up with that increased demand. So that backup is where we see the visible swelling. All right, risk reduction. So I think this little blurb over here on the left is really important. We often find, just speaking with patients, that they feel responsible for developing lymphedema, that they've done something wrong or they didn't do something soon enough. But it's important to remember that the lymphedema really is a cause or is because of a compromise to your lymphatic system as a result of those life-saving treatments. So the surgery and the radiation that you needed in order to, remove the cancer. So these 4 things on the side here are all ways that you can reduce your risk. So exercise, we are going to, of course, speak at length about, and then really bringing awareness to you about potential triggers and how to avoid them when possible. Avoiding excess weight gain or really trying to maintain a stable weight, because if they've gone in and compromised your lymphatic system a bit, and then you're adding more of you're adding more of a demand on a system that's not functioning at 100%. So again, that's where a bit of backup can occur. And then we will talk about early PT and why that's beneficial. All right, exercise. So why exercise? Why so important? So really because your lymphatic system does lie so closely to your muscles, when you're engaging in activity, either aerobic activity, so you're kind of getting your heart rate going, or resistance activity, so using your TheraBands or using your dumbbells to do some strength training, that's causing your muscles to contract and relax. So it's helping promote lymphatic flow. So helping to move things along and helping your lymphatic system to drain things better. Also really important to note that within the research, there has been no relationship documented between an increased risk of lymphedema and engaging in aerobic or resistance training. So it is in fact safe. And again, Jill will talk at length about that in the second part of today's talk. And then also the third point speaks to the fact of patients with existing lymphedema. There's been it's been supported by the research that exercise not only reduces severity of symptoms, but number of flare-ups. So it's beneficial in those with existing lymphedema. All right, so understanding and avoiding potential triggers. So it is our goal that all of our patients are able to enjoy all of their usual activities, whether it's gardening, yoga, boogie boarding, whatever it is that you love to do, but taking reasonable precautions when possible to avoid potential triggers. And again, really what that trigger is doing is something that's going to bring more fluid or increased fluid to that area. And we know that the system can't deal with that increased demand. So for those of you maybe starting an exercise program again, or changing it up a little bit, it's really important to progress things safely. So slowly increasing the weights and resistance that you're using for upper body strength training. So starting real light with a TheraBand or 1-2 pound dumbbells, and then slowly ramping up from there so that your body is able to adapt. We're able to avoid any type of muscle sprain or strain that would then lead to that inflammation. And then the second one is really trying to avoid any type of infection or cellulitis. So say you get a little bit of a nick, cut, or a burn before, on the affected side especially, was what I'm speaking to, before you might ignore it and say, that'll heal in a day or two. But really it's having that awareness, and we don't want an infection to work its way in there. So covering it with the Neosporin, putting the Band-Aid on there. So again, to prevent yourself from potential infection. And then being really diligent about checking for any potential signs and symptoms of infection, and then letting your doctor know right away, not letting it linger. So watching for redness, warmth, fever, all those changes. For those of you that do have a green thumb and you're a gardener, wearing gloves, again, just to protect your hands, avoid any types of cuts. And then for those of you that enjoy being out in the sun, maybe wearing a sun shirt, being really diligent about applying sunscreen, because with any type of sunburn, again, it's going to cause a little bit of inflammation in that area. Okay, so this slide speaks to early PT and why it's beneficial. So this study looked at a group of ladies before surgery, so either before a mastectomy or lumpectomy, and then they were assigned to 2 different groups. So the one group had PT and education for 3 weeks, and then the other group had education only. So they did not get PT, and then they kind of evaluated them at various intervals along their continuum of care. And what they found at a year post-op is that the women in the group with the PT had a much lower incidence of lymphedema, so 7% as compared to 25% in the group that was getting education only. And then they also found that the women in the control group getting education only developed lymphedema more quickly. So again, this just speaks to the fact that when we are able to see patients, pretty close to after surgery, we know that not only is it safe, but it's effective in reducing overall risk for lymphedema. All right, air travel and lymphedema, back when we could travel. So again, air travel and lymphedema, it was once thought that going on a long airplane flight was thought to be a trigger for lymphedema. That has since been debunked. So this Ferguson article that you will see listed below is published in 2016. And what it did, it was a large study. They followed a large group of ladies that went on a long international flight. I think it was Australia. Someone correct me if I'm wrong. But basically they found that that long travel was not associated with developing lymphedema in your affected arm. Some things to keep in mind though with traveling, especially if it's a long international flight, you're sitting for a long period. So you're not moving, your fluid's not moving, it's staying stagnant. So it's harder for your body to move things around. And then with the stress and everything that comes with traveling, often we're dehydrated. So then again, harder for your body to be able to move that fluid around. So most of us get a bit poofier on a flight. So for our patients that are at a higher risk for lymphedema, we often recommend them bringing a sleeve in their carry-on just in case. So say, you get to the Bahamas or Italy, wherever you get to go, that you have that compression garment to wear just in case swelling should arise and you're not scrambling once you get there to try to find something that you need. All right, then I know this is another big one. So blood pressure and needle sticks. So again, I know, and I'm sure many of you are still told this, that to avoid any type of blood draws, needle sticks, blood pressure readings on the affected arm. Again, that same study that looked at air travel also looked at incidence of lymphedema with these blood draws and blood pressure readings, and they found that there was no relationship between number of blood pressure readings and needle sticks that they got and then development of lymphedema. However, a reasonable approach would be, of course, if you're comfortable, to continue to use the opposite arm, but really our goal is that we're able to help take that fear off of you that, should you go to CVS and you get a flu shot and they happen to use the arm where the lymph nodes were removed, well, that's okay. Now you know that there's been a lot of research done that has since debunked that your arm will not get large. However, on the flip side of that, if you needed to get a bag of fluid, say you were, severely dehydrated or something like that, ideally you would be able to do it on the opposite side, the side where lymph nodes were not removed or a less number of lymph nodes were removed, because that's, again, bringing more fluid to the area. And we've talked at length about how bringing more fluid to the area, the side where the lymph nodes are removed, it's compromised, it's going to have a harder time, again, filtering out that fluid. Okay, so early detection of lymphedema, what are some signs and symptoms so you can continue to monitor yourself? Again, thinking back to the onset, anywhere from 6 months to 3 years, so it's really important to have that ongoing surveillance and to be really, really aware of your body, how it looks, how it feels. So this is a prospective surveillance model that was published in 2012 by Jill, also Nicole Stout and Katie Schmitz. And basically, and this is our approach that we have here at Turning Point, but it kind of identifies critical points in time to assess and potentially initiate treatment. So ideally, we would be able to see everybody before surgery so that we're then able to have your true baseline, before they go in and take out the breast tissue and take out the lymph nodes. So we know, we've got, for whatever reason, their non-dominant side just happens to be bigger. I'm one of those people, but it's nice when we get to know those things before surgery. So we know what your true baseline is, and we're looking at your range of motion, your strength, all that good stuff. And ideally, we're able to see you post-op. If there are any or impairments, we're then able to initiate treatment and work on those things. And then really the ongoing surveillance, checking in on the volumes, exercise, strength, all of that stuff. And then throughout the continuum, we've got the ongoing exercise and education. All right, so importance of early detection and treatment of lymphedema. So the research shows that when we are able to detect and pick up on lymphedema very early on, we're able to keep it at a very mild or manageable level and reduce that progression. So again, ideally patients would have their baseline volume, so the volume of your arm in milliliters, done pre-op, or if not pre-op, very early on in your post-op period. And really what this does is, again, it allows us to be able to pick up on those small changes early on so that we can address it accordingly and hopefully mitigate some of those long-term side effects down the road. Okay, so what are some signs and symptoms of arm or hand lymphedema? So typically what patients are reporting to us is a sensation of fullness, heaviness in that arm. They might be feeling more of a presence to that arm, feelings of tightness, pressure, tingling, things like that. Rings, watches may feel tighter, a long sleeve shirt might fit a bit tighter. They may notice some swelling that's there during the day, but then kind of disappears at night. And then decreased visibility of veins in certain areas, or bony prominences may be less prominent. There may be a little bit more poofy around those areas. So you can kind of see in this picture, the little bit of long sleeve that's hanging out, how a little bit of decreased visibility in the veins on the top of her hands there. All right, so trunk and breast lymphedema. So certainly not uncommon after a lumpectomy followed by radiation for patients to have some problems with swelling in the affected breast. So usually, again, they're also reporting to us feelings of fullness, tenderness, pressure. It might feel like a bruise-like sensation. They may notice that the bra is fitting tighter at the end of the day. And then our patients who are undergoing flap surgery, so whether it's a lat flap where they're taking that piece of tissue from the back and bringing it forward on the front of the chest wall, or the abdominal surgery, a tram or a DEEP, that they're using that tissue and then to reconstruct the breast. Not uncommon to have some swelling in the abdomen, side of the chest wall, or even the back kind of near the shoulder blades. Again, they might have the waistband or a shirt feeling a bit tighter there also. Okay, so what are some things that you can do to kind of monitor and detect for early signs and symptoms of lymphedema? So the first one being a knuckle check. So as you can see here, you're making a fist like this, you're comparing both sides, and really what we want to see are these pretty peaks and valleys in between your knuckles. You can see on her left hand, her knuckles aren't nearly as prominent, a lot more poofy, not only in between the knuckles, but on the top of the hand also. So again, something to indicate, hey, potentially something's going on. I need to be seen by my therapist, by my doctor. So again, areas where you can continue to intermittently self-assess. And then other ways you can check are the forearm tissue. So that top picture, she's got her forearms stretched out in front of her like that on a pillow, and you can see, it looks like her right arm, a lot more rounded appearance. Can't see the veins nearly as clearly, a bit more full in that area, especially as you work up towards the elbow. And then the other place you can check is if you bend your elbows up like this, and then probably be easier to check in front of a mirror, and then looking at the points of your elbow here. And then if it ever looks a bit less pointy, more poofy, especially above the elbow, again, indication that potentially something could be collecting there. And then the last one being that bottom picture where she's got her arm stretched out into a T. You can see on her left arm a bit more full, and the underarm here kind of in that tricep area. So again, areas where you can continue to self-assess, be aware of, and monitor going forward. So some methods of measuring arm volume. So quantifying the volume in both of your arms is the best way to quantify and really identify, quantify lymphedema. So to have that objective measure. There currently is no gold standard for measuring volume, but some common methods that are used are the perometer, which if you've been in the clinic, you've definitely seen, and then the Lymphatic, which is a newer technology that Jill was working on with some engineers at Georgia Tech using an iPad, and then arm circumference with a good old tape measure, and then converting that using a formula and converting your circumferential measurements into a volume. So all of those have been shown to be reliable and valid. And then our approach at Turning Point to measuring arm volume, so that top picture is the perometer. And for those of you that aren't familiar, basically the patient's going to sit there in that little chair. The side of their trunk is going to go up against the table. They'll stretch their arm out, and then the therapist will move that box up and down the length of their arm. This is the most commonly used infrared imaging device. So it's got little infrared lights, and then taking a picture, circumferential measurements up and down the length of your arm, computing it into a percentage, and has been shown to be reliable and valid compared to water displacement. And then this bottom one is a bit newer. So this is what we've been working on as we've switched to tele-rehab as of recently. And it has been shown to be a reliable and feasible method of measuring your own arm. And basically you've got that self-measuring tool that you place at 10 centimeter increments, moving up and down your arm, doing it on both sides. And then really it's nice because it kind of gives the patients a chance to be independent and monitoring their arms moving forward and being able to detect and quantify any significant changes. All right, and now I'm going to hand it over to Jill. Enough of me talking.
I think I did it. So thanks, Mallory. So I get to talk about lymphedema management, and unfortunately you're going to hear the word exercise a lot. And just full disclosure, for those of you who don't know me, I'm a breast cancer survivor as well as a PT, and I have lymphedema. So I have been through all of this. So I sort of talking a little bit about myself here, which is, I guess, why I got interested in all of this. So obviously, lymphedema management, it is definitely not one size fits all. It depends on the person. It depends on your stage of lymphedema. But I'm really going over basic principles. What we know from the research is effective in managing lymphedema. And then obviously, if you were here as one of our patients, or if you've been one of our patients, you know that we're really using a number of different tools, and with the goal of trying to keep it as minimal as possible. So, you know, you may not have been given one of these things, but that's, everyone's different. So just to give you a feel, the management of lymphedema depends on the stages. And basically on the left-hand side, I certainly, unless I was in person or close up with the person on the left, you can barely see the lymphedema. So very early, sometimes called subclinical, where there may be symptoms, as Mallory said, heaviness, just a sensation that things just maybe a little tight on sleeves, but really nothing visible. And as you go along the pictures, you will see a gradual increase. And so these are stages of lymphedema. It's staged from stage 0 to 3. We think about that as we're thinking about how to manage lymphedema, but it's not the only thing. But I just wanted to show you sort of that, the progression that can happen. Our whole goal with lymphedema care at this point, in sort of where we are with research in the last probably 5 to 10 years, is detecting it early, as Mallory said, and trying to keep it at that very low level. And to be honest with you, in women where we've been able to do that, we very rarely see it progress to the level that you're seeing on the right-hand side of the screen. So some of the critical components of the management of lymphedema, and this is based on research, is compression. And compression could either be a sleeve. You'll see on the bottom of the picture, that's just a very basic over-the-counter garment. And she's got a gauntlet on. Sometimes we use gauntlets with no fingers, or if someone has a lot of finger swelling, we might use a glove. And the bandaging at the top is sort of when we bring in the big daddy of bandaging. It's not something we would obviously, I guess, hope it's obvious. We would not ever have someone in this all the time, every day for the rest of their life. We typically use bandaging as almost sort of, we put you in intensive care for lymphedema treatment for women that have that more severe lymphedema. And then it might be something that gets used on an occasional basis. If we find, hey, your lymphedema is increasing a little bit, we better bring out the big daddy again. That's something we may use, a tool we may use on an ongoing basis. Exercise, and we'll be talking more about it, so I won't go into that now. really understanding, once you have lymphedema, understanding those triggers, those same triggers that Mallory talked about that may start lymphedema, that increase of fluid in your arm, may also be things that make it worse. Not necessarily that cause it, but just kind of aggravate it. The other thing we think about is just managing soft tissue and joint restrictions. So for example, and it's not uncommon, we may see women 6 months or a year down the road after their surgery and radiation, and they have a little bit of swelling starting, and we also see that they may not be able to move their shoulder fully. That's not an uncommon issue, unfortunately, but that can also magnify or increase their lymphedema because they're not moving their arm normally. So they're not getting that skeletal pumping that Mallory was talking about. Manual lymph drainage is a very light, just on the skin massage that's designed to move fluid away from the swollen area. So in this case, up the arm and out of the arm, and weight management where possible. So they're all sort of the things in our toolbox that we can use depending on the patient. Just recently, this is very hot off the press, literally a couple of weeks ago, our association, our Academy of Oncological Physical Therapy, which we belong to, put out new clinical practice guidelines for the management of breast cancer-related lymphedema. And what this group did was they looked at all the available research on all the management of lymphedema, and they basically graded the evidence we have to support different kinds of treatment, different parts of the tool, different things in our toolbox. And what they found was that there was best evidence, and which means the studies were done well, and there's more than one study that shows it, in many cases, many studies. And they found that compression, aerobic and resistance exercise, and education related to the triggers and understanding lymphedema all had grade A or best evidence. Less evidence to support manual lymph drainage, that soft, lovely feeling massage that we sometimes use for lymphedema, kinesiotaping, and laser. So what we do with this information as physical therapists is we would obviously start at the bottom. We try to treat women, obviously, with the kinds of interventions that have most evidence. And then if we did need to feel that if we had the lymphedema under good control with that, that's where we stop. We would add the other things if we find that we need something extra potentially to make the changes we're looking for. But they would kind of be the secondary things we go to, the ones with less evidence. And finally, there are pumps. We used to use them more often. I'm old enough to remember when we used them almost all the time. They're literally what they sound like, passive pumps. You put your arm in a big sleeve and it pumps, but the research hasn't been very supportive of pumps over the years. So again, that's not a first line of management. So exercise, we keep telling you we're coming to this. So historically, and this is, hopefully none of you have heard this, but we keep finding we'll have patients come in and say that they've been told not to exercise, it might cause lymphedema, or it might increase their lymphedema. So we still feel, unfortunately, that we do have to address the issue. So back in the day, 20 years ago, there was a sense that heavy resistance training, repetitive arm motion, things like tennis, rowing, anything that was repeated could potentially cause lymphedema or increase lymphedema if you had it. So women with breast cancer in general were discouraged from exercising. And obviously you've already sort of heard the punchline that that's changed. And just a side note, shout out to Canada here for our Canadian people listening, there's a couple. The debunking came, yay, from physical therapists. Dr. Susan Harris is a friend of ours. She's was at University of British Columbia at the time, a breast cancer survivor and was a researcher. And when she was told not to exercise back in '99 because it might cause lymphedema, it just didn't make sense. She looked at all of the kinds of things that Mallory just presented on the physiology and the muscle pump and decided that she was going to go ahead and debunk that myth. And she pulled together a group of very brave women because they thought it was going to cause lymphedema. And they decided on a vigorous upper body exercise, and they picked dragon boating. And basically it was done as a study, and the women did heavy resistant dragon boat training, and they measured their lymphedema, and they looked at whether there was new cases of lymphedema and whether those women with lymphedema, if the lymphedema had increased. And what they found was that in fact, there was no new cases of lymphedema, and the women did fine with this vigorous upper body exercise. And it was published in a journal of surgery about challenging the myths of exercise-induced lymphedema. And so that began a whole bunch of new exercise where many researchers have now looked at whether exercise is safe. And in fact, we know over and over and over, it's very safe. And we've kind of moved on now to it's not just safe, but it's beneficial. So what we were telling women 20 years ago when I went through breast cancer is completely different now. It's actually not just that it's safe, but you need to be exercising to reduce your risk or to decrease your lymphedema if you have it. So for women at risk for lymphedema, we know that these are some of the things. Early post-operative range of motion exercises seems to reduce your lymphedema risk. So getting that range of motion back, as Mallory mentioned. Upper body resistance training reduces our lymphedema risk, and weight management programs that include exercise may also reduce our risk. So for women with lymphedema already have swelling of their arm, we know now that exercise appears to decrease exacerbations of lymphedema. So lymphedema, when we have it, tends to be a course. It gets a little worse and a little better, and a little worse, a little better. And what we find that where women are exercising, they don't get those peaks of being a little worse. It evens off those exacerbations. And several studies have actually shown that it decreases their arm volume. So one question has come up is, does it matter what kind of exercise? Are we talking about aerobic exercise like brisk walking or running, those kind of aerobic exercise, or resistance? For a while, it seemed most of the studies were done on resistance exercise, so we kind of assumed you needed to be lifting weights. But from this study, it actually appears that both aerobic exercise and resistance exercise may be helpful in decreasing lymphedema and decreasing risk of lymphedema. So basically, the bottom line is both. There's been some studies that have looked at different special kinds of exercise, yoga, Pilates, those kinds of things. And most of the studies that have come out related to yoga specifically conclude, and this is a systematic review, so it included many studies. We know that yoga improves shoulder motion, spine mobility, and generally just lymphedema was better, but not necessarily a long-term impact of yoga on lymphedema specifically. But again, there's so many other benefits and there's no downside, but it's just an interesting study that that grouped together these studies to show these. In the case of Pilates, there's actually been a study that showed a benefit of Pilates for lymphedema. And in this study, 60 participants with lymphedema were put into two different groups, either a control group that did not get Pilates or Pilates exercise group. They found improvement in both groups, but much better in the Pilates group related to lymphedema volume, severity, and they had some side benefits of body image, function, and quality of life. So there's some interesting work being done out there on different types of exercise, with Pilates being very promising for women with lymphedema. Another question that we get a lot, and we need to guide our patients in, is whether they should or need to use compression when they're exercising. So if they've been given a sleeve, should I wear the sleeve or not? And this is a study that looked at 60 women, and 30 were randomly allocated to two different groups. They both did low intensity resistance training. One group had compression and one group did not use compression while they were exercising. And what they found was that there was really no difference in the groups that had compression versus no compression. So it didn't seem that women benefited or had benefited or had any detrimental effect, whether or not they used a sleeve. And this has been replicated in another study. And in our exercise guidelines for cancer survivors, this was also their conclusion in looking at the research, was that with or without compression, either way, the exercise is still a benefit. And what I was just speaking about was these new international exercise guidelines for cancer survivors. And these are all kinds of cancers, not just breast cancer. But this was specific to lymphedema. And basically, they looked at all the research out there and came up with guidelines for us as patients and us as PTs. And their recommended frequency of range of motion and resistance exercises for women with and at risk for lymphedema is 2 to 3 times per week to get the benefits that we've been talking about related to lymphedema. Moderate intensity, 1 to 3 sets of somewhere between 8 and 15 repetitions. That sounds very prescriptive, but it's also very helpful. Like, how much do I have to do to get these benefits? So that gives us a very good guideline for that. Common sense and physiology suggest that we should start slow and progress. What we're trying to do is avoid potential injury. The last thing we want one of our patients to do is, yeah, I'm going to start lifting weights, and yeah, I'm starting with 10 pounds, and they haven't exercised or lifted weights in the past, and they end up with a strain. And going back, thinking back to what Mallory was talking about, that strain or sprain is an inflammatory process that brings fluid to the area, so could actually exacerbate lymphedema. So as long as we go slow and steady and progressively increase, we just want to avoid injury. There's no studies that have shown that higher kinds of intensity activities like tennis, rowing, dragon boating, climbing, they don't seem to have any impact on lymphedema. So once a person is strong enough and has the range of motion that they need, we definitely recommend our patients getting back to all the different kinds of exercise that they usually like to do. There's no restriction. So summary, this is my exercise, rowing. And right now it's only singles, so it's a great picture because of COVID-19. We row alone. In summary, the risk factors, as Mallory talked about for lymphedema, are the number of nodes removed and radiation and BMI. It's the increased fluid load that may trigger lymphedema, but it doesn't cause it. So we really like to emphasize with women who get lymphedema, there's probably nothing you could have done to actually prevent it, but by getting your range of motion back with early PT, getting early identification, and managing it is really the key to controlling lymphedema. Ongoing surveillance is part of what has been shown in the literature to be really the best practice at this point. And obviously, I'll say it one more time, exercise isn't only safe, but it's important to risk reduction and the treatment of lymphedema. And no one wants it, but we can control it. And I think I'm a good example of someone with significant lymphedema. And it really can, you can live with it, and you can have a full functioning, good quality of life and do anything that we want with it. So it's question time. And it's perfect. We've got about 10 minutes if there's questions. And go ahead, Arelis.
I was going to say a question did come up on the chat. Let me see, just a second. Is lymphedema a lifelong issue?
So, good question. The answer is, in most cases, yes, I'm sorry to say. Once you have lymphedema, it's a chronic condition. If it's not treated, it tends to be progressive, not in everyone, but in general it is. So it's where we want it to be chronic. That's totally a bad thing to say. If it's chronic, where we want it to be is at that very low level. But in general, it doesn't go away.
Okay. Another question is, are there other telltale signs like itching and swelling that you should be concerned about? Are there other telltale signs like itching and swelling that you should be concerned about?
Itching specific, I'm going to start and then I'll let you talk as well. Sorry, Mallory, it's hard
No,
for me
you're
to
fine.
tell who's next.
You're good.
Itching itself is not specifically a sign or symptom of lymphedema developing that I've ever heard of in many years, but definitely any kind of swelling that is on your affected side more than your unaffected definitely could be a sign of lymphedema. We should check it out. If someone, we all swell up, you know, you eat more salt, you eat salty food, we don't exercise for a couple of days, we all get puffy. If it's the same on both sides, I wouldn't be concerned about lymphedema. I'd just watch what you eat and get some exercise. But if it's on your affected side, then yeah, it's something that should be looked at.
Thank you. One of the questions that we had received, and I just want to make sure, I'm not sure if I heard the answer to it, but if you're this patient is 6 years later from being cancer-free, no swelling. However, they have read that it can appear and happen anytime. Is there any point that they can say, it's been 10 years or 15 years, I don't have to worry about it anymore? Or is that potential always there?
That's a great question. So like we talked about in the previous slides that I had, so usually the typical onset, again, 80% of women, it does occur about a year after treatment, but it really can be anywhere from the time frame that's 6 months to 3 years post-treatment. Not necessarily likely, yes, if it was going to happen, it does happen within that time frame. However, it's really, really important to emphasize that ongoing surveillance and really being aware of those potential triggers. And then as best you can, try to avoid potential triggers, and then really trying to maintain a healthy lymphatic system, kind of like Joe was talking about with watching how much salt we eat, which is tough during, quarantine as we're baking our way through it, really trying to exercise regularly. And then again, understanding your risk factors and then those potential triggers and trying to avoid them so that you can minimize your risk as much as possible.
Thank you. Elaine, did you want to type your question or did you just want to go ahead and ask it?
It was sort of long, so it was easier to ask if I might.
Okay, go right ahead.
And it was the point about not so much blood pressure, but the thing about blood draws on the affected arm. I do have lymphedema. They always have trouble not taking blood, but like when you have a test where there's contrast, it's always this real to-do to find a blood vessel that will do this on the unaffected arm. But I'd always understood can't touch the affected arm. But now it seems like this new study is saying they could do it on that arm. Am I correct?
I'll go ahead, Mallory, and then again we can tag team. There's a difference in my mind. In that study, they were looking specifically at a needle stick blood draw, which has very little real, it's a very minor impact. The study didn't look at IVs, and if you are getting an IV to put in contrast, in my mind, we don't know that yet. And I'm guessing, knowing what I know about the lymph system, I would avoid, and personally, I would avoid getting any sort of an IV on that side if possible. And you're right, Elaine, it's a big to-do. There are other places to do IVs, and I assume, Elaine, you're talking about contrast, you're talking about an IV, right?
Yes.
Yeah.
Yes.
You can get them in your neck, and I know it sounds terrible. That's where I get mine when I have surgery, which is kind of common when you're a breast cancer survivor. There's most of us have many surgeries. It sounds horrible, but it's actually doable. You can get them in the top of your foot as well. It's not my favorite place, but I've tried them all. So it is an issue, and it might be the kind of thing to really talk through both with your PT or someone here, like where should I do and what do I ask for? But then you also have to talk to your surgeon about it as well, or when you're going in to get tests. So I didn't answer your question. It is a tough issue.
Well, and that's what I thought. And I've learned some things through trial and error, and sometimes with a really good tech that help to be able to do it a little bit easier. They use the baby needle, and one of the big things for other people, they've found that if they warm the area, they have an easier time of getting a vein to kind of pop up for them and take it better.
So you're talking about how to make it easier on the unaffected side, correct?
Correct.
Yes.
Correct.
The other thing is a lot of time, if you're not, to make sure that you're well hydrated when you get an IV stick,
Yes.
can help a lot.
Sometimes hard to do when they don't want you drinking anything before,
Yes,
so your
correct.
stomach won't be upset. Thank you.
Thank you, Elaine. So another question, this individual had a bilateral mastectomy in June and has been seeing a PT for axillary cording. Does this put them at a increased risk for lymphedema, and should she be wearing a prophylactic compression?
So certainly it sounds like Nicole, you're pretty early on in the post-op phase. So again, we would expect you being only about a month and a half-ish out to, of course, have some post-op swelling. Again, not necessarily lymphedema by any means. And certainly that post-op swelling can lead to a bit of a backup of the lymphatic system, ultimately leading to that cording. Not necessarily because you're having this cording it hasn't been shown in the research, at least, to be one of the risk factors for then developing lymphedema. Certainly it is suggestive of having a bit of a backup and congestion in that lymphatic system. So as you continue to work on that cording, continue to work on that range of motion, hopefully that'll help to, again, facilitate that muscle pump action to get things moving again and promote that lymphatic flow. Okay.
As far as
sorry, yeah, go ahead.
The other part of the question was wearing sleeves to prevent lymphedema. And it's an interesting topic. As far as I know, and if any of the PTs watching have anything I have to add, I have not seen a study that is definitive that shows that if someone that is at risk for lymphedema wears a sleeve preventatively, that it will prevent lymphedema. What I think could happen is that if you're at risk for lymphedema and you get early lymphedema, you've got a sleeve on, it's basically like us treating you when you very early. It's before you even knew you had it. So yes, it could be effective because you're basically wearing a sleeve all the time to do this early treatment. The issue is that even if you look at all women with breast cancer, regardless of their risk factors, it's 20% of women. So we would be putting compression sleeves on all women almost that are at risk for lymphedema, with only 20% of women needing it. And that's the issue. So that's why we don't say all women should do this preventatively, because if a woman gets lymphedema and it's mild, and we can treat it, and you may be in a sleeve only and doing exercise for a few weeks, and then you're in and out of your sleeve, and we're managing it very low, at a very low level, they end up at the same place as someone who might have worn a sleeve to try to prevent it. So so that's why it isn't sort of common to put all women in sleeves. Also, last thing is, when you have lymphedema, especially if it's at a low level, we can manage it. I hate to say it, but it is just swelling. It's not painful. You have full range of motion. So again, it seems like a lot of effort and impact on a woman to wear a sleeve preventatively for something that, as long as we know about it and we can manage it, then we do it at the time.
Okay, one last question, and then we're gonna wrap it up, and I'll let you know where you can, if you have additional questions, where you can send them. But last question for the PTs, if you have lymphedema under the arm, can something similar to compression help?
So there certainly are various types of compression that you can put in, you know, against your skin under like a light compression camisole or some type of compression bra. Same idea behind a compression sleeve. You're just giving the lymphatics in that area a bit of a boost and helping things to move and drain a bit better. Also, hate to say it, exercise, I had to say it one more time, but also effective in using your own system, your own muscle pumping action to help move things along in that area. So whether you're doing some deep breathing, you're doing some stretching to work out some of the, you know, the soft tissue tightness, and also getting the muscles going in that area is also effective in helping to rely on your own lymphatic system to help get some of that poofiness in the underarm away.
Thank you. And just, I think Carrie answered somebody's question on the chat. Just for those of you who don't know Carrie and wonder why is Carrie answering questions on the chat, she is one of our senior physical therapists here at Turning Point. So she knows what she's talking about, and her answer is professional. So thank you,
Sorry,
Carrie.
I just wanted to make sure that you guys did know the difference when we're talking about, even if you've had surgery on both sides, the at-risk arm is still just that arm with the lymph nodes actually removed. So the one where the side of the cancer actually was. So we certainly have lots of patients who do truly have bilateral cancer, but your bilateral mastectomy, if your cancer was only on one side, it's still just the lymph node side that's at risk.
Thank you. Thank you. Thank you so much, everyone, for joining us. Just before we go ahead and wrap it up, just want to let you know a couple of things that we have going on here at Turning Point. For some of you, you may know we did have a Pilates class that's temporarily on hold because of the pandemic, but we do have Work It Out Wednesdays, where our physical therapists do have a recorded workout video, and you can watch those and go back and watch any of them. They are on our Facebook page and also on our YouTube channel. So those usually get released every Wednesday. So be on the lookout for those. We are offering tele-rehab appointments to all breast cancer patients with no out-of-pocket cost. So we can help you get a referral if you want to come in to see us. Please send us an email to staff@myturningpoint.org, or you can call our office and we can definitely help you with that. The same, we offer emotional and nutritional support.